Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about ICD-10 CM PCS updates 2024 second quarter part 3. In this video, we are going to cover two coding clinics, and the first one is dementia and epilepsy and the second one is heart and light chain amyloidosis. So let's get started with the first one, dementia and epilepsy. And the scenario here is when referencing dementia, there is an index entry that states in due to epilepsy with the etiology code listed first, followed by the manifestation code in brackets. So as you can see here in the index, when referencing dementia, the index entry states in due to epilepsy with the etiology code listed first, followed by the manifestation code in brackets. It appears that the classification presumes a relationship between these two conditions based on the with convention as well as the etiology manifestation convention. Should coding professionals assume a link between dementia and epilepsy, or must the provider establish a relationship? And the answer here is, when the health record documentation does not specify the underlying cause of the dementia or support epilepsy in or due to dementia, query the provider to clarify the underlying cause, since dementia may be due to epilepsy or epilepsy may be due to the dementia. If the provider cannot issue clarification of the cause of the dementia, then assign code F03.90 for unspecified dementia, unspecified severity without behavioral disturbance, psychotic disturbance, mood disturbance, and anxiety, and code G40.909 for epilepsy unspecified, not intractable, without status epilepticus for a diagnosis of dementia and epilepsy. It would be inappropriate to assign code F02.80, dementia and other diseases classified elsewhere, unspecified severity without behavioral disturbance, psychotic disturbance and mood disturbance and anxiety, unless the provider clearly documents a relation between the two conditions. So if the provider is documenting the relationship between the two conditions, at the time we can take F02.80. But if there is no relationship between these conditions, at the time we have to code them separately. Unspecified dementia and unspecified epilepsy. Now moving towards the next coding clinic, heart and light chain amyloidosis. And the scenario here is a patient with chronic congestive heart failure presents with a 5-month history of shortness of breath and dyspnea on exertion. The patient underwent several tests and a biopsy, which were all suggestive of cardiac amyloid light chain amyloidosis. The provider's final diagnostic statement listed cardiac AL amyloidosis and acute and chronic diastolic heart failure. The question here is, what are the appropriate diagnosis codes for cardiac light chain amyloidosis? And the answer here is, we have to assign code E85.81 for light chain amyloidosis and code I43 cardiomyopathy in diseases classified elsewhere for the cardiac AL amyloidosis. Additionally, we have to assign code I50.33 for acute and chronic diastolic congestive heart failure. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.